we kind of talked about this one, and we landed on was I noticed a client at a skilled nursing facility, and he wasn't really eating or enjoying his food. And I noticed that he had a lunchbox that his family brought on their visit, and I just came in and talked to him, and I just asked him if he was enjoying his meal, and he explained that he didn't really like it. It wasn't really what he preferred to eat, and he said that his family brought food, but he didn't want to trouble anyone to heat it up and like do anything about that. So I just was like, oh, let me heat it up. It will take, 5 minutes. So I grabbed everything and heated it up, and then I brought it back to him, and he just told me that he started explaining like that he missed country, like food from his home country, and that he just like, if he felt like that food helped him heal better than like maybe the food that was serving at the facility. So I just sat with him for a while, and he kind of just talked about his childhood, growing up in the Philippines, the food he ate, and then the food that he taught his kids how to make, and how that his kids brought that food in. And he just shared with me how special it was to him, and that he really looks forward to going home and like having those dishes with his family. And I just was really touched with how much he wanted to share with me, and how important, food was to him, and how, it really did make an impact on his day being able to eat what his family brought him rather than, being forced to eat at the facility. And that just, again, it's just those really small things you do as a nurse that aren't even on, that aren't in order, or, the patients might be too scared to ask you, but it's just those small things that make a really big difference to them and their healing. And yeah, just, I always try to keep my eye out for a way to, make my care more tailored to people's experience and culture.
Okay, cool. I like it.
I wasn't working as a nurse, but I was actually working as a greeter and a screener at a hospital. And we would check patients in or check visitors in to visit their family members. And I had one specific visitor who had brought in like a little prayer item. And they had asked me to bring it to the room and put it at the patient's pillow, because at this time it was during COVID, height of the pandemic. They weren't actually allowed to go in. They could bring items and we would bring it in. And they just really emphasized, like, can you please, put this at their bedside? And normally we would call up to the unit, and the UA, the unit assistant, would come down and get it. But I just felt like, I was like, I can go up there. And I feel like because they're asking me something so specific, I really wanted to make sure like it was done. So when I walked up to the unit, I was like, is it okay if I go put this item at the patient's bedside on their pillow? They're like, yeah, absolutely. Thanks for bringing it up. But I just felt like I really wanted to do that. I wanted to, respect the family's wishes. So I did that.
Yeah. Yeah, I
Yeah.
think that works. And then I would add something at the end about like what your takeaway is going forward, or like maybe how much you appreciate living in an area where you get opportunities to learn about other cultures, and
Okay. I
I
like
don't know,
that.
some
Yeah.
kind of like take it forward or like gratitude piece for it.
Mhm.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel. If you use the discount code YouTube, it's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
One of the diabetic students that I had that wasn't completely self-care, which meant she came into the health room for lunch so I could verify her insulin and her carb count and things like that. She was Muslim, and so when it was Ramadan, she really wanted to participate in it, but she wasn't sure exactly how to navigate that since she was diabetic. And so I worked with her doctor to get orders that were specific to Ramadan, and it had like recommendations that she should at certain times, like when the sun was down, and then the insulin amounts that would go along with that, along with like doctor's notes that I gave then to the teachers to be extra careful in watching her in case her blood sugar dropped, and for like PE and stuff like that.
That's really cool. I love that. Yeah. Yeah. And you could just say maybe an extra piece of like, you love whenever there's an opportunity to bring part of someone's culture from home, like into their care and tailor it. That makes more sense for their preferences. That it's always like a really great opportunity that you appreciate, or I don't know, something
Yeah.
to broaden it a little bit.
No, I had this elderly female patient, and she happened to have a male nurse that day. And she did not want her male nurse to come into her bathroom. So she needed somebody to support her, ambulate her to the bathroom, but she didn't want male nurse to do it. So I was there, so I helped her. She was really grateful. And I talked to her. She said, nobody but my husband really should see me in the bathroom. And I go, oh, that's so sweet. And we actually built a good relationship with this patient. And I don't think the nurse switched, but in the end, somehow I was taking care of her a lot more than what happened. But yeah, her nurse. And we actually did her walk because she didn't want any male to touch her either. So PT wanted her to walk, but she didn't want male nurse. So I was, walking down the hallway with her, and we really helped each other. And she was very happy about this situation. I'm sorry, I didn't mean to talk about the nurse switch, but something happened and I can't remember the whole story. But I'm just gonna say that I was there to support her need and desire. Yeah.
And then maybe say something at the end just to finish it off, that like every patient has their own individual preferences, and you love to be able to learn what it is that will make them the most comfortable.
Right.
Everybody's different.
Right. Yeah, that's one of the first thing I try to ask, is there anything I should know about, your culture or your background? I mean, it's just, there's so many. So yeah, I will do that.
Yeah. And sometimes for the patients who are nonverbal, like when you can't, the translator isn't really going to help because they can't talk. So when you see like their family, you can ask like, what are their favorite foods? Like their appetite has not been good. Like what do they love? Like,
yeah. Well, that's what I do for the palliative care house, because almost all of the kids are nonverbal.
Yeah.
And I basically we have this chart that it doesn't talk about, of course, disease or anything, but it talks about what the kids likes, and we kind of like, play around what he might like this day, she might like that day. They are nonverbal, but they can communicate in a way that you can tell that they're not happy or they need something, or they're very happy. So yeah, that's something I do.
Yeah, so a time I provided culturally conversant care is when I had a patient and she was a Muslim female and she had to get a straight cath for urinary retention. And I was working with my male preceptor that day. And so when we went to the room and I told her about the procedure and why we were doing it, knowing that she was Muslim and that Muslims tend to be more modest, I asked her if she would feel more comfortable if instead of my male preceptor being there, I got a female nurse to come watch me as I did the procedure. And the patient said that would just make her feel a lot more comfortable and willing to go through with it. And so that is exactly what I did. I grabbed a female, and overall, it really just made the patient more comfortable and happy with her care.
Yeah, add something on the end that kind of broadens it out, not just from like that one experience, but how you handle those situations overall. Maybe something about how you found it's really important to ask questions and really listen to what people are able to share with you about their preferences, and like anything you can do to make them more comfortable while they're in the hospital.
Oh, got it.
Yeah.
So that just like that situation made me more aware of just like asking patients questions and really going out of the way to make them feel comfortable in the hospital.
Yeah.